Welcome to June 2025. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Lots of things to read in the June issue of PCCM. 3 feature articles, 3 clinical investigation articles, a PCCM trial, a PCCM conference report, 2 research letters, a PCCM narrative, a PCCM notes, and my own editor's notes. So let's start with the features. The first is by Lopez Fernandez et al., and this is the prevalence and outcome of acute hypoxemic respiratory failure, or PANDORA, in Spain, 22 PICUs, 2019 to 2021, over 1,300 invasive mechanical ventilation patients, of which 91 met PARDS criteria. The second feature is by Chapman et al., and it's about organ procurement barriers. 64 personnel provided data, and there's an editorial. And the third feature is by Duster et al., and this is about the use of early sodium bicarbonate in in-hospital cardiac arrest, 2013 to 2023, 243 events, and there's an accompanying editorial. In the clinicals, we have 3 articles. The first is by Zhu et al., and this is on augmented renal clearance in early sepsis, 69 patients, 2022 to 2023. The second article is by Vo et al., and this is on explanatory factors of mortality in mechanically ventilated patients with severe dengue, 2013 to 2022 in Vietnam, 200 children in that study. And the third is by Nice et al., and this is on the topic of enteral nutrition initiation in non-invasive ventilation, single center, 2019 to 2023, 512 episodes. The PCCM trial is from the PROMPT bolus study. This is 3 centers looking at 478 children and trying to look at analysis of trajectory data for AKI. And there's an editorial in this. In the PCCM conference and expert panel report, this is by Andrist et al., and this is about themes in management of contested brain death cases. And there's an editorial, and I'm sure that this is going to lead on to more work. The 2 research letters, one comes from Baker and Spader, and this is on the Phoenix sepsis score in CICU. The second is by Gathers et al., and this is a survey of 81 fellows in 15 different programs in 2022 about diversity engagement. The PCCM narrative is by Schruten and Markovitz, and it's titled, "Just because I can't talk doesn't mean I have nothing to say." The PCCM Notes, Methods and Statistics is by Blake Martin et al., and this is on the topic of area under the precision recall curve. Many of you who read the Phoenix data will know that this was used. And lastly, in my editor's notes, third in the series, is on respiratory support for bronchiolitis management. So thank you once again for looking at PCCM. See you next month.